morning, our attentive audience. We are National Youth Service Corps member of the Medical and Health Community Development Service Group at Ika South local government. So today we'll be talking on postpartum depression and general health tips. I have two speakers with me. The first speaker will be talking about we're talking on postpartum depression, while the second speaker will talk on general health tips that will range from hypertension to diabetes to effect of exercise on general health being.
My name is Dr. Hussein Matthew. Um, I'll be talking on postpartum depression and why women suffer great mood swings and despair. Why women usually suffer an episode of sadness during and after pregnancy. You are welcome to the show once again.
My name is Dr. Eze Chidebere. I'm talking on some health tips and then basic understanding of hypertension, the risk factors, and then exercise. Thank you so much. Welcome.
So, postpartum depression is a topic that is usually ignored and overlooked, yet it forms a very big bulk of our health burden and problems after childbirth. So I'll quickly explain what the term postpartum means. Postpartum period, or as some people will call it, puerperal period, is a period that begins after childbirth till 6 weeks. So from the moment you deliver a child or a baby till 6 weeks, you can call that period from birth to 6 weeks postpartum period or puerperal period. And this period is usually eventful sometimes because after the successful birth of a baby, you see everybody's rejoicing, congratulating the said woman or couple, and the health of the woman is ignored. A new baby has just been born. A new baby has just been born, and this usually distracts the entire family members, friends, from paying attention to the woman. The woman is suddenly ignored and forgotten. All attention go to the baby, and because of that, it is very, very difficult to pick up when a woman is experiencing sadness or despair, when a woman is experiencing mood swings that is consequence to that particular episode or index delivery. So on this show, we hope to first of all enlighten the public that there's something called postpartum depression, or you can call it puerperal depression, and how to look out for the signs that may suggest that a woman is undergoing depressive episodes, and to also tell us that it requires a clinical diagnosis and a medical management. So on this show, I'll quickly introduce what postpartum depression means. Postpartum depression is a mood disorder that commences immediately after birth. Sometimes it can take up to 2 weeks after birth, and it is usually consequent on that episode of delivery, causing a lot of sadness and despair for the woman. It is usually said to have to occur within a couple of hours to days to weeks, and it may even last up to a year in about one fourth of sufferers. It should be noted that the etiology of this condition, funny as it is quite significant. For instance, the etiology of the incidence of postpartum depression is about 15%. That is to say, for every 100 deliveries, you will have about 15% of people undergoing postpartum depression, and nobody is talking about it as a major health burden. Postpartum depression is actually is actually a very important mental health disease. It's actually a psychiatric disorder after pregnancy, and it forms a part of the spectrum from what people call baby blues or puerperal blues, where a woman just swing mood a little, she's sad, everybody is congratulating you about a baby, you don't seem to be happy. People expect you to be joyous, you don't seem to be happy. People, we call such condition baby blues or puerperal blues or postpartum blues. If not checked, it may progress to what we call postpartum depression, where the woman now needs actual medical and psychological care. If the woman fails to access medical care, you will now start to have issues with issues like psychiatric disorders, postpartum psychosis. Postpartum psychosis is consequent from untreated and ignored episodes of postpartum depression. So I'm quickly going to run through the etiological factors. By etiology, I mean the possible causes of postpartum depression. One of the major causes are biological changes in biological systems of that woman. After birth, the woman's hormonal system tries to rebalance and return back to normal from excess production of progesterone and other pregnancy hormones. The woman now start to reset back to her normal self before she got pregnant. And this reset may cause a little mood swing that may make her a little depressed and a little unhappy. So a very common risk factor is sudden change in hormonal level in a woman that just put to bed. Other risk factors, other risk factors that may put a woman at risk of suffering from puerperal depression or postpartum depression is poor diet. Now you will discover that puerperal depression is very common among the poor and less privileged because they don't eat good food, and so their nutritional intake is usually not enough to support that particular pregnancy. The baby that the woman just delivered to does not care if he don't eat well or not. It takes exactly what it needs from you. So with poor diet, you may be at risk of suffering uh, puerperal depression. Other risk factors are stressful conditions, stressors of life. A woman who has been stressed all through her life without parental care, without care from spouse, may suddenly become unhappy, thinking about the bills that you are going to pay. Life stressors also contribute to postpartum depression. Others are changes in lifestyle, sudden happenings in life, like a woman who was rocked or who was duped and now discovered, or who was raped and now discovered she was with child, may predispose her to puerperal depression. However, we are going to look quickly at uh, possible symptoms you should look out for when you are evaluating a woman with puerperal depression. When a woman gives birth and she's not happy about the birth of a newborn, that should be a very strong marker that the woman is depressed. Another thing you should look out for is insomnia. When a woman, after giving birth, finds it difficult to sleep, even when the baby is sleeping and she does not have any reason not to sleep, the baby is not crying, the baby is sleeping peacefully, she still finds it difficult to sleep, we should start getting ourselves worried that this woman may be experiencing depressive episode. Others are when the woman started that she's having some intrusive thoughts. Thoughts just start coming to her head to hurt herself. Thoughts start coming to her head to hurt the baby. How are you going to take care of this baby? Kill the baby and kill yourself. Whenever she starts hearing or start complaining of these intrusive thoughts, you should start suspecting strongly that this woman is suffering from puerperal psychosis or from postpartum depression. Another is when the man starts having this sudden anxiety, this sudden panic attacks. The man is scared for no reason. We should start evaluating such a woman for postpartum depression. Now, when a woman gives birth, we expect the woman to be excited about her baby. Now, when the woman starts losing interest in caring for the baby, she does not care if she's lactating or not. She does not care if the baby has eaten or not. We should start getting worried because she just gave birth to her significant side. She just gave birth to her replica that contains virtually most of her genetic materials. So she should be excited. It's something that should excite her. You should be excited for no reason. When she starts losing interest in caring for the baby, we should also start to suspect that she's undergoing episodes of depression. Some women may even start to weep and cry. They weep so much and cry. You don't know why they are crying. They are just weeping. We should start suspecting, and we should, in fact, call a mental health physician to evaluate such a woman for postpartum depression. When a woman is having difficulty bonding with her baby, now, one of the ways you bond with your baby is to establish breastfeeding within 30 minutes of birth. Now, when a woman starts having difficulties establishing bonding with her baby or even initiating breastfeeding, she start to suspect puerperal depression or postpartum depression. When the woman suddenly starts withdrawing from friends, the woman does not want to see anybody, the woman is withdrawing from friends, the woman is not happy. Those are part of the symptoms you should look out for. When a woman starts complaining of overwhelming fatigue or overwhelming loss of energy, you should start suspecting that she is currently undergoing postpartum depression. When a woman starts feeling as if she no longer have interest in what she used to enjoy, in medical terminology, we refer to that as anhedonia. A woman that loves cooking no longer wants to cook. Few days, few weeks after delivery, we should start evaluating that woman for postpartum depression. A woman that loves gossiping with her friends, of course, women gossip a lot. A woman that loves gossiping with her friends, if she stops gossiping, please beg her to gossip. Ask her why you're no longer gossiping. If you used to do pillow fights with your partner and suddenly your partner is no longer interested in pillow fights, please beg her to begin pillow fights. You should be worried. These are subtle signs that she may be giving away to show that she's currently having depressive episode. When the woman is now scared of motherhood and the responsibilities that follow motherhood, she's now asking you, so I'm now a mother. Does that mean that I can no longer go to parties? She's now scared of the new responsibilities of motherhood that has been bestowed on her. You should softly look into her eyes and look deeply because she may just be undergoing depressive episodes and you may not be aware. You should not allow puerperal depression to deteriorate to the point of psychosis. Of course, I told you that it's a spectrum from baby blues to postpartum depression, then to postpartum psychosis. You should not allow her to deteriorate. Early management is key. Like as I said, about 15% of all births usually is associated with postpartum depression. And if this is not managed within weeks, it may even exceed 6 months, sometimes even up to a year, in about 1/4 of sufferers. So please whenever we suspect that a woman is undergoing puerperal depression, it is more than psychological management. The woman is mentally sick and needs psychiatry evaluation. That does not rule out the importance of psychological care and care from family and friends. It is different from postpartum psychosis because in postpartum psychosis, you start to have manic episodes. She starts to behave irrationally and aggressively. There was this case of a woman who delivered in a certain teaching hospital in Edo State where she attempted to jump from the first floor of the building via the window route. I don't know what she saw. She wanted to jump from the window down to ground floor. So puerperal psychosis can come with manic episodes. It can come with hallucinations and those symptoms you see in schizophrenia. So whenever a woman is suffering from postpartum depression, we should quickly evaluate her and offer both medical treatment, psychological treatment, and family support so that she does not progress to being psychotic. So I'm quickly going to talk about how you make a diagnosis of postpartum depression. You don't have to wait for the doctor or the nurse to recognize that your wife or a relative or a friend is suffering from postpartum depression for you to quickly take action. Remember, I told you that the earlier you take action, the better it is. As the Americans will say, time is muscle and muscle is time. So the faster you intervene in puerperal depression, the faster it is and the better the human benefits from it. Now, to making diagnosis is strictly clinical. There is an Edinburgh postnatal depression scale that is usually used. I'm not going to go too deep into this for clinicians to consume. Again, you can have clinical interviews with the patient. Ask the patient, since you've given birth now, do you still feel like doing those things you enjoy doing? Are you happy? Do you desire this baby? Try to find out if there's any stressor in that woman. Ask whether she's having support from partner, if she's having family support. Ask questions that will bring out the signs and symptoms that I've earlier discussed to see if she's possibly suffering from this postpartum depression. Remember that I said that if you don't treat this on time, it may result to a psychosis. In fact, you may even confuse a depressed woman or a psychotic woman who is suffering from puerperal depression or psychosis. You may even confuse her to be a mad woman because she will no longer take care of herself. She becomes dirty. It will affect, consequentially, it will affect the care of her child. In fact, her husband is also affected. An important point I want to quickly draw is that postpartum depression can affect men too. I know that it's the women that get pregnant and suffer all the stress of labor. But even sometimes, men suffer postpartum depression. They may have big bellies, but they are not pregnant. But they still suffer postpartum depression, even if they cannot get pregnant. A family unit is seen to be one. What rubs on one rubs on everybody. Even the child suffers when a woman is depressed because it's only a woman who is mentally, physically, and psychologically fit that can care for a baby and recognize the immediate needs of a baby. So I'll quickly talk about the possible treatments for postpartum depression. Like as I said, the most important step is to quickly recognize that a woman is undergoing depressive episode. Once that is established, The woman should benefit from prompt management or referral if you're not in a medical facility. If you don't have a medical professional, the woman should benefit from prompt referral or presentation to a healthcare practitioner, preferably a psychiatrist, a mental health physician. Then the woman should also have psychologists come to counsel her. Also, part of the one of the most important part of the treatment is the use of antidepressants. Antidepressants are medications that can help in depressive episodes. So we usually employ the selective serotonin reuptake inhibitors like sertraline, paroxetine, and the rest of them in that family. We prefer sertraline when we are dealing with pregnant women because sertraline has been found to be minimally excreted in breast milk. So the fear of infant or child toxicity is overcome when you use sertraline to manage a woman with postpartum depression. So, like as I've said, the woman needs family support and support from friends, and especially has support from spouse. In a well-organized society, we are supposed to have support groups to care for women suffering from postpartum depression. So I will await comments from audience and possible questions for clarification wherever you are not clear with. So in summary, postpartum depression is a mood disorder that results shortly after giving birth that is responsible for sudden sadness or despair in a woman. And I said that it can happen within hours to days to weeks. And the effect can last for months and even up to a year if left untreated. Another point I want to emphasize on is that men too can suffer postpartum depression. And that even when there's a joy of, even when there's a gift of a child and the joy of motherhood, and the woman is not happy, we should not only focus on the baby that has been delivered. Attention should also be given to the woman who just delivered. And in fact, to the fathers of this baby, we need attention too. So I will advocate that we should have World Father's Day, yes, to celebrate fathers who also suffer from depression. Even if you are not pregnant, it's not easy to father. You have to buy plenty of breast milk substitute and Pampers. If you think about this, you may have depression. So I will advocate that the world recognizes postpartum depression, grants it a day of celebration. Focus should be on the mother who just gave birth, and fathers should not be ignored too. So thank you for your attention. Thank you for listening. I hope you enjoyed my show. If there's any question, you can bring it to the house, and the team of National Youth Service Corps doctors will be happy to answer your questions. Uh, Thank you.
Our online viewers can also drop their questions in the comment section and attend to the question. So since we are done with the postpartum depression, we'll now move to general health tips. So the second speaker, the person of Dr. Chidebere Eze, will now talk on the general health tips.
Okay, I want to welcome you once again to this discussion. I'll be talking on this concept of different misconceptions concerning some health issues. For instance, the issue of a wider test that's been misunderstood by the general public. Now, it's a normal thing that whenever somebody has or is feeling feverish or is having headache, the person will go to one side lab to do one or two tests. And in most occasions, they will come to the clinic and then present to you their lab results, showing that they have a paratyphy or typhy, which is a serological test that is increased. Now, I want to make you understand something. This wider test, it is non-specific. It is a highly sensitive test, but it is not diagnostic. Why am I saying this thing? Because most people think that if you have a positive wider test, that you have typhoid or you have typhoid fever. Now, for us doctors, before we can make a diagnosis of any diagnosis, there must be clinical symptoms and then the signs going down to laboratory investigations. So you can't just make a diagnosis of typhoid based on serological investigation, which is the wider test, because it is non-specific. Why is it non-specific? Because there are other things that can also give you this result to be positive. For instance, if you have upper respiratory tract infection, which in most cases is caused by viral infection. Now, these viruses, they trigger our bodies to produce what is called antibodies. Now, those antibodies can also cross-react with the reagent that is used in that wider test. So you can see that for most of us, especially the adults, you can have repeatedly positive wider tests and still you don't have typhoid. That is number one. Number two, if you are living in an area which you have endemic malaria, for instance, in our own zone, in the tropics, we have malaria and it's endemic within our system. So if you check your wider test, it's going to be positive. And it may reach 1/180 in some cases. So that does not mean that you have a typhoid. There must be other features of typhoid in your system. Now, what you must understand about fever and typhoid is that there is something called step ladder fever. Now, because of the use of analgesic, the paracetamol, diclofenac, and other things, we may not actually get the clinical pattern of typhoid fever. That is the fever and typhoid. Step ladder in the sense that you see how ladder is. That is ladder you use to climb a stair or whatever. Now, that's how the fever in typhoid is. It goes like a range, step up like that, until the person gets to the point of coma. And there will be other gastrointestinal symptoms. For instance, vomiting, abdominal pain, diarrhea in some cases, and other things that will be associated apart from the fever itself in that individual. So there are many things that people misunderstood concerning the issue of a wider test. That's what we want to bring to the notice of the general public. That one aside, now I want to also enlighten us concerning a concept of kidney failure. You know that kidney failure is on the rise within our society. Now, why is it like that? Why is kidney failure on the rise? One of the major causes, because the main purpose of this my talk is just to enlighten us to bring to our notice the possible causes of this and what we should do about it. Now, one of the major causes of kidney failure is hypertension. Now, when I need to ask questions, why is a young adult, maybe 25 years, 37 years, why is that person having kidney failure? Because most adults are hypertensive, but they don't know. Now, how can you know that whether you are hypertensive or not? Is by checking yourself, by going to the hospital to know the level of your blood pressure. Now, what is hypertension? Because that is another concept that we have to understand. What is hypertension? If I have checked my blood pressure and in one occasion, it is that is systolic. The systolic is one that's above and it is up to 140 and or 90. 90, that is below, the one that is below is 90. In two occasions, separated at least 4 hours apart, that individual that is an adult is hypertensive. So you must have checked that blood pressure in 2 occasions. Now, hypertension is rising as well as kidney failure is rising. That is number one. Then another thing I have to also know, one of the causes of kidney failure is diabetes. Diabetes. This show cannot contain the discussion of diabetes, but just know that if you have diabetes or you have the risk factors of diabetes, you are at risk of developing kidney failure as well. For instance, one of the risk factors of being a diabetic patient is that if there is a family history, like one of your family members, especially your first degree relatives, maybe your parents or your sibling, any of them is diabetic, you are likely going to be diabetic. So you must check your blood glucose level and also watch out for the symptoms of diabetes. Then another thing that is paramount, very, very important, especially amongst the young people, is use of chemicals, ranging from creams and other things. There are some creams that we use in our society nowadays that contain high level of or some level of mercury. Now, mercury is an agent, a substance that can destroy the kidney. So most of those lightening objects that we use or cream that we use, most of them contain mercury in it. Another thing that also important you should also know is the use of drugs. I was in an emergency and a young guy came to the emergency. What happened? He was presenting with, he came with leg swelling. What caused the leg swelling? When I asked him some questions, I found out that he's an artisan. And then he used to use diclofenac, ibuprofen for a long time because after work, body pain, so he has to relieve the body pain. Now, when you use those drugs, diclofenac, ibuprofen, and other drugs for a long time because of pain, they are going to go to your kidney and destroy the prostaglandins that are produced by your kidneys. The prostaglandins, they are needed to cause what is called renal vasodilatation to relax the vessels of the kidneys, thereby allowing blood to get to the kidney. So in those instances when you take those drugs for a long time, they will prevent your body from producing those substances, and then the kidney will be short of blood. Of course, it's going to die from that. So this is another thing. So use of all those NSAIDs for a long time is another risk factor or cause of kidney failure. Now, let's go back in details concerning this issue of hypertension. Now, there are two types of hypertension. Number one is what is called primary hypertension, otherwise known as essential hypertension. The second one is secondary hypertension. Now, when we talk about secondary hypertension, we mean that there is a cause, there is a known cause of this hypertension. But in essential or primary hypertension, we don't know the cause. So most of us, most people, especially in our place, 95% of people that have hypertension, they are suffering from what is called primary hypertension. So one of the risk factors of these hypertensions are if you are a man, male sex is a risk factor for hypertension. That does not mean that every man is going to be hypertensive, but most men are likely to be hypertensive more than females. How? We don't know. Maybe because of stressors, psychological and environmental stressors. Then, if you are from Africa or you have black race, you are likely going to be hypertensive than a Caucasian. If you also have a family history of hypertension, maybe your father or your mother or your sibling is hypertensive, any of them, you are likely going to be hypertensive as well. Then if you are obese or overweight, which is a modifiable risk factor for hypertension, you are also likely going to be hypertensive. That does not mean that anybody that is obese or overweight is going to be hypertensive, but likely going to be. Now, talking about the secondary causes of hypertension, there is an important one that we should know about, which is the one that is caused by drug. Because amongst the young people these days, we make use of cortisol. Now, cortisol, there is steroid. There are drugs that help you to build yourself. Some of us that want to build our bodies, want to get shape and get fat or get muscle. Some men, some bodybuilders. Now, if you are using steroid for a long time, you are likely to develop hypertension as well as diabetes, because it is also a cause of diabetes. Now, if you also have what is called thyroid toxicosis, in this sense, it means that your thyroid gland, that is a gland that is here on the neck and through part of the neck, is acting or functioning more than normal, you are likely going to also be hypertensive. So this is another cause of secondary hypertension. Now, what are you going to do when you know that you are hypertensive or in all these cases? One of the things you are going to do is do what is called exercising. Now, there is something I wanted to tell us, but it's not going to be contained in this video. Talking about the classifications of hypertension, especially the essential hypertension, is going to be contained in this video. Now, if you can indulge in exercising is one of the ways or non-pharmacological or non-medical treatment of hypertension, non-medical treatment of diabetes and obesity as well. Exercising. Now, there are two forms of exercising. There is something called aerobic and anaerobic exercising. What I teach and what I encourage people to do is aerobic exercising. Aerobic exercising, for instance, jogging, walking, running, skipping, swimming, table tennis. These are some of forms of aerobic exercising. Anaerobic, like push-up, like people want to maybe build their boots and other things. Those ones are anaerobic exercising. But if you want to get rid of hypertension or diabetes, what you should do is aerobic exercise. And it has been proven that is for people, especially the young people that have what is called stage 1 hypertension. In stage 1 hypertension, your blood pressure is less than 150. That is in stage 1 hypertension. So that is systolic is less than 150. So 150 to 159, that is in stage 1 hypertension. So in those individuals, if you can be able to be exercising, say 2 to 3 times in a week, 30 minutes to 1 hour in a week, and you have stage 1 hypertension without comorbidities. Comorbidities are things that I've mentioned before, like diabetes, obesity, and other things. If you can do all those things, you are likely going to help yourself. Exercise also helps your mood. For instance, relating this exercising to what we have just discussed, the first we talked about postpartum depression. Now, if you can exercise helps your system to build the happy hormones that's called the endorphins. Now, those endorphins can stimulate your brain and make you to be happy. That's why most times when you exercise, you feel happy. You become so happy or so excited because that's what one of the things your body is going to release, the endorphins. So exercising is going to help, and also it's going to help your blood pressure to come down by causing vasodilatation and peripheral relaxation of the vessels. That's one of the things that I most encourage us to do. So, just like an overview of our discussion. Okay, before I summarize, let me talk about this issue of obesity. There is something called generalized obesity and truncal obesity. It's important we know about it. Now, in obesity, there are some parameters that we're looking at in obesity. We're looking at what is called body mass index, looking at your weight and then your height in meters squared. If you have checked your body mass index and is up to 30, it means you are obese. But there are some individuals that their body mass index is not up to 30, but they have what is called truncal obesity. And the truncal obesity is associated with cardiovascular manifestations, like cardiovascular diseases, that is heart diseases. So if you are exercising, it's going to help you to burn down the fat. How do you check whether you have truncal obesity? By using a measuring tape to check your abdominal circumference at the level of the umbilicus. If you check it, and for a man, it should not be more than 102 centimeters. That's the WHO standard. And for a woman, it should not be more than 88 centimeters. If it's more than that, that means you have what is called truncal obesity, and it's a risk factor for having heart diseases. So that is just like a kind of health tip that I want to bring to our notice. And then, just to recap, I talked about wider tests, hypertension, diabetes, and the causes of kidney failure. So I want to thank you for listening. Thank you and welcome. Thank you.
Thank you once again, our dear audience, for your time. as part of the general health tips, I want to quickly talk about one of the issues that is causing a lot of uh, deaths and morbidities in youths and young women, sometimes married women, the issue of unsafe abortion. So it is important that we quickly use this opportunity to enlighten the public and to discourage strongly the practice of unsafe abortion among teenagers, young women, and sometimes married women. We should know that abortion remains illegal in Nigeria, and it's not and never encouraged by the federal government of Nigeria or by our religious institutions. We forbid it and discourage it strongly. What is worse with abortion is that most of these persons that do abortion practice unsafe abortions. They practice unsafe techniques, putting their life in danger. And these things have has its own future consequences on the health of the individual and the life expectancy of that individual. So, for a quick introduction, unsafe abortion is one that is illegal, criminally done by one who does not have any medical expertise, who is not trained medically, or an abortion that is done in a place that does not have the prerequisite facilities. If I mean prerequisite facilities, I mean that is not up to the standard of a modern theater, or one that has both. So it's either you call it unsafe if it's done by an individual that does not have the prerequisite skill, or it is done in a place that does not meet the criteria of a good theater, or a combination of these two. For those that still have difficulties understanding what I just said, it is an inappropriate abortion done by an inappropriate person in an inappropriate place, or a combination of both. So I just want to quickly enlighten the public, part of our general health tips, that we, the medical and health CDS group, we are strongly against abortion generally and strongly discourage unsafe abortions. I want to enlighten you that unsafe abortions can have consequences later in life. Consequences, consequences that can be immediate, such as bleeding, uterine rupture, sepsis that can become life-threatening, to issues with fertility, issues with anemia, and reduced quality of life. So we first advocate abstinence. We advocate abstinence for those that cannot practice abstinence, and you are unmarried and you don't desire a particular pregnancy. We encourage you to use protection, barrier methods, use of condoms. And if you have done a criminal abortion, you should quickly seek a health professional to alleviate symptoms and to nurse you back to good health. Thank you once again to our public and our diligent listeners. You've been, we appreciate your effort. You've been good. Thank you. So we will encourage and appreciate questions so far from the audience, so that the team of National Youth Service Corps doctors will reply to all of your questions and clear doubts. We also encourage questions from general medical practice, and where you seek clarification We will do our best to clear out doubts and to straighten knowledge. Thank you.
If there are questions from the audience.
Okay, our viewers can also click on the link below the PMCV page. There's actually a video of a woman that actually suffered postpartum depression. So there's actually a video of it, so you can click on the link and watch the video. So it's actually give us an idea of how the manifestation of postpartum depression.
Good day, everyone. My name is Jim Ojami. My question is on postpartum depression. As an African or as a Nigerian, we live largely on rural environments where we don't have access to quality healthcare. And as an African, we usually believe on spiritual attacks, traditional ways of caring for ourselves. So it is majorly believed that whenever a woman is suffering from postpartum depression, it is either she is spiritually attacked or the family will take it as a stress. And in most cases, when the patient presents, since we don't have access to most time teaching hospitals, we usually go to primary health care or secondary health care. Whenever such patient present themselves to the hospital, the person in charge usually describe it as a stress from the childbirth and whatsoever, and usually prescribe taking sleeping medicine to ease the stress she is passing through. So I want to ask, how long should a woman be managed at home? Because we don't usually have access to quality health care. How long should a woman be managed at home before being presented to a teaching hospital or a better healthcare center for postpartum depression case? Thank you very much.
Thank you for your questions. It is greatly appreciated and encouraged. A woman who is suffering from postpartum depression should access medical care as soon as possible. The longer medical care is delayed, the worse the prognosis from postpartum depression become. Prompt presentation to medical experts can quickly alleviate symptoms and nurse the woman back to life. If you delay medical management, the woman may progress to becoming a case of postpartum psychosis, which may now be indeed very difficult to manage. Like as I said, 15% of women who deliver suffer postpartum depression. And of this 15%, majority should recover within weeks to about 6 months postpartum after delivery. And that one fourth may even progress beyond 6 months, even to a year, if medical care is not assessed. So we strongly advocate prompt presentation to the hospital. We understand that it's a disease of spectrum, that it comes from it starts as baby blues or puerperal blues down to till it becomes puerperal depression, then finally a psychotic disease. So once you notice a puerperal blue, it is advised you present to the hospital. However, if there's a delay as a result of the various delays, either due to traditional or religious reasons, and you want to delay, we should be able to recognize and to differentiate puerperal depression from mere puerperal blues, where the woman is just moody and just unhappy. So we should not allow the disease to progress. A stitch in time saves what? 9. Thank you. Thank you. So prompt diagnosis is the key.
I think there's also another person that's signified. Okay.
Okay, good morning, everyone. I actually have two questions. My first question has to do with the failure. The kidney failure. I know that the human body has two kidneys. So the kidney failure, does it affect both kidneys at the same time, or can it affect one and the person can still make use of the other one? That's my first question. And the second question has to do with the postpartum depression. I want to ask, can we see those signs before delivery? like maybe underlying conditions or signs that that a pregnant woman can show before delivery that can make us know that she might have postpartum depression later after delivery? Thank you.
Thank you for your questions once again. They are greatly appreciated and encouraged. Um, she she asked if there are signs and symptoms a pregnant woman will exhibit for us to suspect puerperal depression. While during the course of giving this talk on this show, I have once outlined that we have what we call risk factors that put the woman at risk of having postpartum depression. If you have a woman with poor parental support and poor partner or spouse support, you should strongly suspect puerperal depression. A woman who has poor diet or is having stressors, life stressors, we should strongly suspect puerperal depression. If the labor or during the labor process or even during the antenatal process, the woman suffered a lot of medical illness, some forms of medical diseases like pregnancy-induced hypertension or hypertension in pregnancy, whatever the case may be, or the woman even suffered what we call preeclampsia when a pregnant woman starts to have organ disease, multiple organ disease, which laboratory-wise we do urinalysis to ascertain the quantity of protein, what we call significant proteinuria in urine. If you can ascertain that truly this woman has suffered hypertensive disorders in pregnancy, as outlined. I said pregnancy-induced hypertension or hypertension in pregnancy, as the case may be, preeclampsia or even eclampsia, or the woman suffered diabetic crisis in pregnancy, such as gestational diabetes mellitus. We should strongly suspect that these women are at risk of having postpartum depression. Again, was the pregnancy desired? The circumstances around which the conception was achieved. A pregnancy that is not desired, a pregnancy that was achieved from circumstances like rape, like child abuse, or close relative incest, we should expect puerperal depression from such. Sometimes we cannot really tell which woman will actually come down with puerperal depression. Like as I said, hormonal changes consequent to the delivery of a baby can cause puerperal depression. But you cannot make the diagnosis of puerperal depression until after delivery of a baby. The term is called puerperal depression and not antenatal depression. It is not natal depression, but postnatal depression. Puerperal depression is another word for postnatal depression. Puerperal depression, postpartum depression, postnatal depression, afterbirth depression, whichever that is convenient for you, are all talking about the same clinical states. So you will rely on only risk factors to give signals or to give signs that this person may come down with puerperal depression in future.
All right. Concerning your question about whether the kidneys, whether one will be affected and then the other one will not be affected. Now, it depends on the cause. Now, most of my causes or discussion are based on systemic causes. Now, consider the kidneys to be like all of us in this building. Do you understand? So, if anything should happen in this building, the percentage that most of us will be affected is higher. Do you understand? So, say for instance, hypertension. If that hypertension is caused by systemic something, for instance, essential hypertension, do you understand? So it's going to affect the both kidneys. If it's caused, for instance, by say a cream, the cream is not going to be told go to the right kidney. Do you understand? It is only on occasion whereby there is something like isolated kidney infection. Do you understand? That's something like pyelonephritis, maybe on the right. and then it is now affecting the kidney, or there is obstruction of one part of the kidney outlets. That is an instance where you can have isolated kidney failure. But in most cases that are due to systemic illness, both kidneys will be affected equally. Thank you.
Okay. Some of our I would actually like to acknowledge some of our online viewers. They've been following the conversation in the last, let's say, about an hour now. And that's the viewers. I would like to acknowledge them in person of Onyeka Okonkwo, Pauline Ode, Ofoli Christopher, Naomi Love, and others. So, and this conversation, we are streaming this conversation live from the NYC Secretariat at Ika South Local Government Area, Agbor in Delta State, Nigeria. So, is there any other question? Okay, there's someone there.
Raise your hand.
Okay, so my question is, since we have postpartum depression, is there prepartum depression?
Come again. And louder.
Do we have prepartum depression? Since there is postpartum depression, so is there what we call prepartum depression?
You heard our question. You heard our question. Someone else.
Thank you for your question. It is very welcomed, appreciated, and very much encouraged. Now, postpartum depression, like as I said, it's a clinical diagnosis that happens. It's a clinical diagnosis of is a mood disorder that happens after childbirth. In fact, when you are classifying diseases, postpartum depression is actually classified under mood disorder. It does not stand on its own when you are classifying, when you are doing standard classification of diseases according to the DCM. However, a woman may experience depression whilst being pregnant before delivery. In that instance, you make a clear diagnosis of depression. Depression is a clinical diagnosis that have what we call major symptoms and minor symptoms. So you need, out of the three major symptoms for making diagnosis of depression, you need at least one major symptom and two minor symptoms, or two major symptoms, of which anhedonia is one of the major symptoms. And other major symptoms, you have other minor symptoms like suicidal ideation, depression, weakness, that usually happen almost all through the day. So depression on its own, it's not just a religious or a spiritual state. It is a medical diagnosis and a disease, a medical disease of the mind that needs diagnosis by a health care provider, by an expert, a medical expert, preferably a mental health physician, a psychiatrist. But when this depression is not happening after birth, and we can attribute it to one of the events that occurred after birth, you can now call it postpartum depression. Otherwise, depression can happen to anybody, to any age, at any stage in life, as differentiated from postpartum hemorrhage. Sorry, from postpartum depression. From postpartum depression.
Okay, one of our
Thank you.
speakers has a YouTube channel, and this YouTube channel is actually is a dedicated channel for health tips generally, and his conversation ranges from hypertension, pregnancy, diabetes, and general well-being. So, Dr. Izzy can
Okay.
talk more on the channel.
So I want to thank the PMTV Africa for giving me the platform to announce my own YouTube channel. So to the audience, I have a YouTube channel where I discuss about health issues, importance of exercising and other matters within the society. So my YouTube channel name is Eze Chidebere. So you can go there to listen to some of my talks concerning health issues. Eze Chidebere. Thank you so much.
Okay, we'll drop the handles of his channel in the comment section for our viewers to actually go and check the different videos he has actually made on general health tips and different medical topics. On behalf of the medical and health community development service group.
Okay, wait. Question from you.
Okay, yeah, 6 questions.
Where are we talking from? So we are talking from Ika South local government area from the Nysc secretariat. Is it only doctors that can perform abortions? If not only them, what other professionals can perform abortion? I would like to be silent on that question because the Nigerian government forbids abortion.
Take the question
And
louder so that others can hear.
now the question is it
From
only
who?
doctors
From
that can perform abortions?
From who? Who is that?
From Ofori Christopher. From Ofori Christopher. Is it only doctors that can perform abortions? If not only them, what other health personnel can perform abortion? Now, I want to say that abortion is illegal and strongly discouraged by the federal government of Nigeria. And if in future it is legalized, the guidelines is that for you to perform a safe abortion, you must have the prerequisite skill. You must have the prerequisite skill. You must do it in an environment that is deemed suitable, that fits that meets the standards of an organized or a modern theater. Unless these two conditions are met, what you are doing is an unsafe abortion. One who is not trained in obstetrics and gynecology, who has not received either basic training in obstetrics, in gynecology, and midwifery is considered a quack and must not undergo the process called the clinical procedure called an abortion. So if you are not trained, if you are not formally trained, you don't have an MBBS, or you are not registered with any midwifery council, is to say that you are not trained. So I will say that if you do so, it is strongly discouraged. You are not licensed for such a procedure, and it is still illegal in Nigeria to perform an abortion. And the medical and dental council, and I think the midwifery council and all the nursing councils should, I think, support my claims that we discourage abortion, and we are pro-life, and we say no to unsafe abortions. Thank you.
And we still have a question from one of our viewers online.
No question?
It's from Chidima Gift.
Okay.
He said, what are the chances of surviving kidney failure?
What are the chances of surviving kidney failure? That's the question from
Chidima Gift.
Chidima Gift.
Okay, Chidima Gift. The question concerning surviving kidney failure. Right now, the survival rate, I cannot give you the statistics of survival rate, but the chances of surviving kidney failure after 5 years of making diagnosis of end-stage kidney disease is low. That is after 5 years of making diagnosis of end-stage kidney or renal disease. So I cannot give you the specific number of people that will die maybe within the 5 years of making this diagnosis, but it's quite low. The number that will survive it, because of the other series of complications. Although you can go and what is called renal replacement therapy, which ranges from dialysis to kidney transplant. Now, in people that have done kidney transplant as well, their survival rate may, the number of days or years they may have on it may increase, but still, the chances of them living longer than their normal people is reduced as well. Thank you so much.
Do you have any
other
questions from the audience?
Okay, let's read out this for them.
Okay, if for any reason you didn't join the live stream, you can always drop your questions in the comments section, and we'll respond to your questions accordingly.
So thank you, our viewers, for your patience and for your time. We appreciate all of it. Thank you.
Thank you so much.
So I will invite the president to give the final notes before we end the show.
Read out these questions outside.
All right, before we end it, let's quickly respond to this question. Is postpartum depression why some women have mental issues after birth? The answer is yes. Postpartum depression, like as I said, can progress to postpartum psychosis if left untreated. So the reason why many women have mental issues after childbirth is from untreated postpartum depression or poorly treated and wrongfully application of herbal concussions to women who should be receiving medical treatment. So women can suffer mental health issues from childbirth if postpartum depression is left untreated. Is there any more questions?
Do we still have more questions?
And from also Chukwemeka Amara, is it treatable?
Yes,
Postpartum depression?
postpartum depression is very, very treatable. It's very, very treatable, and prompt presentation is key to successful treatment.
So, on behalf of the Medical and Health Community Development Service Group of Ika South Local Government, I actually like to appreciate our viewers that give us their attention in the last 1 hour. We also like to thank the PM TV Africa for giving us the platform to educating the populace on postpartum depression and general health tips. And in addition, I also thank the National Youth Service Nysc, through our local government inspector, Mr. Ikeshuku, for approving this program. And there's no way I will not thank all my CDS members, those who actually contributed in planning this project. So we actually look forward to do more of this and to discuss other health topics that we didn't really get to dissect due to time constraints. So thank you very much.
Thank you, sir.
Thank you.
Is there another question?
This from Ifunaya. Is there anything that can be done during pregnancy to prevent or reduce the risk of postpartum depression?
Yes, please. Yes, please. During pregnancy, once you notice risk factors in friends, relatives, or with your partner, then you should try to, as much as possible, eliminate such risk factors. Pregnant women should eat properly, attend antenatal classes, take care of their health, treat any medical disease that may predispose them to postpartum depression. Family support is key also. Strong family support, we should also set up groups, support groups, and to also look after pregnant women. Much care is needed to finally minimize the incidence of postpartum depression among our women and including our men.
In addition to that, exercising is also important. Exercising will help most pregnant women, especially those that have some of those risk factors. Exercise, especially aerobic exercise, minimal or moderate exercising, like dancing, is also important. Thank you so much.
So thank you once again. We'll continue under the comments section to answer your questions. I'll be happy to be your host. Thank you.
Thank you very much.
Keep clapping.